Welcome to Grow Your Wellth, the podcast where scaling a successful brand and your wellness go hand in hand. I'm Rena Goodwin, founder and CEO of Factor PR, a top beauty, health, and wellness PR studio, and I'm here to help you work smarter, not harder. Each week, we'll talk branding, marketing, and business growth alongside real, practical insights from trailblazers who are building businesses without the burnout. If you're ready to grow your brand, protect your energy, and design a life you love, you are in the right place. Let's grow. Hey guys, if you've ever felt dismissed or rushed or bounced around from specialist to specialist without real answers, especially if you're a woman, this episode is going to feel like a long overdue exhale. In this episode of Grow Your Wellth, I sit down with the founders of the Well Westlake, a women's healthcare practice in Cleveland, Ohio, built around a simple but revolutionary idea that women deserve comprehensive, connected care that treats the whole person, not just a single symptom. Dr. Bahar and Dr. Maral share what inspired them to start something different alongside their mom, how their inside-out approach integrates gynecology, aesthetics, hormonal health, and nutrition all under one roof, and why that model is changing what their patients think healthcare can actually feel like. We get into the real reason why so many women don't feel like themselves and why that experience has been dismissed for way too long. We also talk about perimenopause and menopause, what hormone replacement therapy actually is and who it's right for, how tools like GLP-1s, IV therapy, and nutrition changes can all work together as part of a personalized plan, not just for women, but for men too. And we also go a little bit behind the curtain on some of the practice's favorite aesthetic treatments, from microneedling to PRP injectables, and why the line between feeling well and looking well isn't really a line at all, especially for entrepreneurs. So if you're ready to dive in or ready to share more, here's Dr. Maral and Dr. Bahar of the Well Westlake. Dr. Bahar, Dr. Maral, so excited to have you here on the Grow Your Wellth podcast. Welcome, and thank you for joining me today.
Thank you for having us.
Thank you for having us. We're very excited to be here.
I'm so excited to have you here because I know working with you ladies that everyone is in for such a treat today. First and foremost, before we dive into all of your incredible expertise and knowledge that you're going to share with us today, I'd love if you could share your story behind the well and specifically the gap that you've seen in women's healthcare that really inspired you to build something different in this space.
Sure. I'll get started and then pass it on to Dr. M. So we were all working in different large institutions around the country. I was in New York. Dr. M was in Baltimore, and my mom was here. And we just noticed that women's care was underserved, fragmented, not cohesive, and a lot of delays in access. And we thought we could do better and we could bring a better entity to women in Cleveland, Ohio. And that's kind of how the inception of the idea started. And then we pondered upon it for many years before implementing. And here we are. So
Yeah, I think we definitely, there's just a huge gap between what women are experiencing and what is being offered in healthcare at this point. And I think that's what triggered us to really get this going, is to fill this gap a little bit better and make it more comprehensive, cohesive. You know, it's not just one part of your healthcare, but it's all of your healthcare. It's encompassing. So that was where, this idea kind of grew from there, and developed it over the last few years.
And to add to that also, we wanted to create a particular kind of environment. So not only to give access, not only to create good tailored care for patients, but also just thinking about the space, being thoughtful, where patients can get comprehensive care under one roof, and respectful of their time. They feel safe when they're here. They feel comfortable when they're here. They feel they're being taken care of.
Absolutely. I definitely got that vibe when I first stepped inside as well, too, where, I can imagine as a patient, when you're feeling maybe a little bit anxious, a little bit nervous, maybe you're coming with some baggage from previous experiences with different, physicians, you might feel a little intimidated. And I could just definitely feel stepping inside like, ooh, this is a vibe. This is very, very nice. Like you forget about, the past and you're just focused on being present right now. So kudos to you guys, because I'm a big believer as well in terms of an environment really sets the tone from the moment that people walk in the door. So I just want to double tap on that idea of, this fragmented sort of women's healthcare environment that so many of us have either become used to or we've experienced at some point in our lives. What did you notice, especially working in women's healthcare all of these years? Was the disconnect? Why haven't women been treated, equally, fairly, holistically, even in sort of more traditional healthcare environments, do you think?
That's an excellent question. And it's a tough one. And it really depends on what environment you're in. But a lot of healthcare has now focused on just the preventative things, So yes, your mammogram, your pap smear, certain symptoms that, we have good protocols. But a lot of what has changed, I think, is, for women is there's a period of time when you're in your reproductive years and focus is just placed on pregnancy. And then between pregnancy and perimenopause, menopause, it's just like, yeah, these are normal symptoms. Your body's going through this. It is what it is, but there's so much that we can do in that time frame. But I think healthcare now has gotten fragmented in the sense of it's just what we need to do to keep the preventative stuff going, but not all the other components of women's care. And, 20, 30 years ago, even or the last decade, it's changed so much because people are advocating for themselves more. And I think social media has shown that, no, this is not okay. These are symptoms that there are things that we can do. And it can be a more conservative, functional approach. It can be more medication. It's just so many options, and people learning about those options and educating yourself about those options is what's key. And not just saying, well, this is normal, just bear through it,
And the fragmentation in larger health systems is because of time. I think a female patient sees their gynecologist and explains symptoms, and they address some of the symptoms, some preventative, some not. And it's like, oh, I have skin changes and hair changes, which happens with perimenopause, menopause. Oh, okay, then you should go see a dermatologist. And they go see a dermatologist, but then the dermatologist is not communicating with the gynecologist as to what their treatment plans are. And I think that's where it causes fragmentation. And I think also women are busy. They're taking care of their families. They're taking care of their kids. They're responsible for getting their husbands, spouses into seeing physicians. And that in this day and age takes a lot of time. So I think sometimes they kind of let themselves fall to the side because they're taking care of so many other things. So that also adds to the fragmentation. Like, oh, I don't need to go see another dermatologist. It's fine. I'll deal with it. Yeah. My preventative gynecologist said everything's good with my pap. So it doesn't allow the female to get past the first, second layer. Again, adding to the fragmentation.
Absolutely. I mean, just hearing you talk about all of the steps just to get answers and so forth, it sounds exhausting. And who has time to, right? And in so many cases in like traditional healthcare settings, it can take weeks, if not months, to see someone as well. And then by that point, you're like, forget it. Like you said, my pap smear's normal. I guess everything is just fine.
Yep. Your kid has a performance somewhere that you're like, I can't make this, and the next one's 9 months away. Like, it's just it hurts the female the female patient at the end of the day.
Absolutely. What I really appreciate about your kind of mission also at the Well is this notion of women's healthcare from the inside out. I thought that was so brilliant as well. Because I remember I've had another physician on the podcast before. She has a very similar philosophy to you guys, but she works in PT. And she had mentioned that so much of healthcare is really not healthcare, it's sick care. And I thought that you guys had sort of addressed that really well, just in terms of all of your messaging. What does that mean, women's health from the inside out?
Yeah, so I think, we have gynecologists on staff, 2 of them here every day. And then we have other providers. We have ultrasound technicians, we have lab techs, we have nurse practitioners qualified to cover dermatology, aesthetics. So inside out means let's evaluate what's going on based on symptoms, labs, ultrasounds. The gynecologist reviews all of your test results, understands your symptoms, and then we can also address the exterior. So if there's skin changes, hair changes, weight changes, we can address all of that under one roof with people who are in the same space and can speak to one another and create a comprehensive plan. That's really in a nutshell what it means.
Yeah, I think there's so many things as a gynecologist that I can evaluate. And then there are things that are more on the outside aesthetically that our nurse practitioner can address. And we work together to create a plan. And that's the thing. We're all talking about it. We have one single patient. We're like, okay, this is our plan for all these things. And I think it makes a huge difference when it's in one space and you don't have to worry about, okay, now I have to go for this appointment here and I have to go there. Okay. It's very, very hard when you have a busy schedule to juggle all of it. And I think that's the benefit of the inside out approach is having everybody there to kind of give you their education that you need. And you ultimately make your own decisions about what you need, but it's the education component that's so huge.
I love that. I think that having a plan too just naturally signals trust with, a patient as well as with a physician that you're going to be there for them every step of that plan. And there is either a solution to, let's say, a problem or an ailment, or even just a path to feeling and looking better. Also, I think what's really also innovative, if you wouldn't mind telling us about the kind of aesthetic side of your practice too, because that is something I think that is still kind of up and coming in most of America, is this marriage between, OBGYN, women's healthcare. And then on the aesthetic side, you can kind of cross over into the other vicinity, get a facial. I mean, brilliant. How have you been finding this integration working with your patients? Are they loving it?
I think our patients that take full advantage of it, love it. I had a patient here that was here from 1 p.m. till about 4 p.m. yesterday. She came from her own care. On the gynecology side, she received an aesthetic treatment and then continued to take her appointment with her daughter on the gynecology side, and then introduced her husband to our practice as well. Wow. Because we covered men's health as well on the aesthetic side. So again, I think it allows for comprehensive care. So we make sure we see and hear our patients, what they're seeking, and starting off with, a good evaluation, a comprehensive evaluation by one of our providers, to understand what are their goals, and then creating a plan. The aesthetic side, we're called the fun side by our patients. And I think it works well because they come in, they do their pap smear, which nobody loves to do, but we try to make it enjoyable, but then they come to our side and get a facial or an injectable, or address a skin concern, pigmentation, textural issues, that they've been concerned about. And it feels good that they're managing some of the symptoms that they're experiencing, all again under one roof, where they can easily flow between the two sides.
And I think when you physically feel good, you show up different for the world. Your confidence is different. Everything, your patience, your just general demeanor changes when we can get you feeling good about yourself, and some of the more aesthetic side allows for that. Yes, there's a whole medical component depending on what's going on that needs to be addressed and focused on, but also externally, it really makes a difference how you feel.
And to jump on that, actually, I truly believe when there's that kind of alignment between internal and external, you feel at home with yourself. And when you feel at home with yourself, you show up better, differently for the world, your kids, your community, etc. So that's where we think there's tremendous value in terms of what we're trying to do.
Oh, absolutely. I see it 100%. I mean, for most of our listeners, they're in their 30s, 40s, even 50s plus, and they're running a business. Many of them have families at home as well, too. And it can be so easy to put yourself last, as you alluded to earlier, like, oh, I can't get in that appointment. There's just not enough time in the day. And, I myself, like you ladies, you're in a service-based industry. We're always like, clients got to come first. Clients got to come first. But 100% how we take care of ourselves, and we talk a lot about this on the podcast, helps us show up in the world differently, not just because we look better and we're glowing and all of the things, but we really do feel better, like we're taking good care of ourselves. And when we can take good care of ourselves, we can take care of others too. But let's talk about that sort of modern woman that is maybe in that midlife stage, right? And she is running it all. She's killing it. She's doing a good job. She's taking good care of herself, but doesn't feel like she is. I'm sure this woman comes into your practice from time to time, if not every day. I hear about them on social media. I have felt like that myself too. People are chatting. Why is it that all of a sudden women are bringing up, feelings of perimenopause and things like that? Are we just giving it a name, or has this kind of been around for forever?
Yeah, I think it's been around forever, but I think acknowledgement was very slow to catch up with how women were feeling. So what I hear a lot of the times is I went to my, X, Y, and Z, and I was kind of dismissed or rushed through or not really given the time to kind of dive deep a little bit. And that's the thing with these symptoms is you have to dive deep. You've got to get to know your patient. You have to understand their lifestyle. You have to understand what they do, not just for work, but their family structure, because all of that affects how we give recommendations, right? How do we slow things down? How do we allow you to feel better about yourself? It's about breaking it down and saying, okay, once or twice a week, this is what I want you to start doing. And it's slow changes. We can't make changes everything overnight, right? But it's about that consistency of first identifying it and then coming up with a reasonable plan that actually fits into your lifestyle. Not just throwing a medication at it, but understanding what's the point of the medication? What are we doing here? What is the long-term goal? And I think for many years, a lot of women were dismissed, unfortunately. And now there's more light because of social media. People feel more comfortable talking about it. And there's a spotlight on it because everyone's talking about it now. And there is a space for it. I just think it was ignored for a long time.
Yeah, there's definitely increased awareness. And I think, a common theme that we hear at our practice every day is women come in and they just want to feel like themselves again. Like that's something that we hear constantly. And I think it's, we're allowed to talk about it. We're allowed to say, I don't feel like myself. And let's dive into what that means. And it's also because the women have more awareness. And I think there's more of a marriage, that between, aesthetics and wellness. It used to be separate, and it was, if I'm seeking aesthetics, it's for different reasons. I won't put labels on it. But now I think there's more of a marriage that aesthetics and wellness and health is all tied together. So people feel more comfortable talking about it. There are the right providers there to give the education and knowledge, share of knowledge. So I think it's been there for decades. I think we're just in a different place now, and women feel more comfortable talking about it.
And friend groups is something I've noticed a lot. So you get one friend in a friend group going, and then you end up seeing all the friends because they're talking about it, right? Which makes me very happy when I get referrals from someone's friend or sister-in-law or mother. It just means they are talking about it, which is the way it should be.
Absolutely. Love that transparency. Something, if you don't mind me touching on the two that you just mentioned, I'm curious about when women say that they don't feel like themselves. Do you have an explanation for that? Like, what is going on that a woman suddenly, or maybe it's not suddenly, starts to not feel comfortable in her own skin or like herself, like her identity is changing, but not in the way she wants, it sounds.
Yeah, I think it's a mix of things, depending on their age. So we treat people from 16 on up. So I don't know what the oldest patient we have is, but 70 plus. So it's a huge range of patients that we see. But a lot of them are in the perimenopause, menopause age group. and they're going through different symptoms. Life's catching up with them. Time is moving a lot faster than it used to. So they're coming in, taking that pause, hearing these conversations amongst other women, and just feeling like maybe they need a reset. They need a balance, and they're not sure what that is. And that's where Dr. M was alluding. Sometimes you need to see the patient more than once. It's not just lab and diagnosis. It's what's going on. What are your symptoms? Why do you not feel like yourself? Understanding the social impacts, the professional impacts, the personal impacts of what's going on within their lives, doing the lab work and getting to know the patient. So sometimes it takes them 2 to 3 sessions of meeting a patient before they can even have let's start here and do a little bit of trial and error, because it's not clear cut. And that's, again, something that I think I can say very well, that we try to tailor it to each patient. It's none of this is clear cut. None of it is a one size fits all. We try to listen, understand, and then respond.
And sometimes I give assignments like, let's go do a food diary for a week and let me see you back in a week, or let's do a symptom diary for a week. So tell me what days, what times you're feeling things, so then I can understand a little bit better, what is actually going on in your week, and how is your diet impacting it? How's your exercise regimen? Okay, we don't have those on board yet. How do we start to incorporate that into your day? What can we feasibly and do things that actually fit into your lifestyle? Because like you said, it's not one size fits all. Everyone's different.
Yeah, we have to also understand their patterns. Right. I think that's what's also important. So again, it's not I see you once and I can understand your patterns. I have to give you tasks or homework to go and keep diaries that come back to me, so we can really understand what some of that is leading to someone not feeling like themselves.
That's smart. That feels like data to me, right? Just being able to take in those patterns, as you put it, and be able to, ultimately put together a customized plan for someone. That also leads me, Dr. M and Dr. B, to an article, actually a few articles that you were recently tapped in Women's World, Flow Space, just to name a few, on the subject of hormone replacement therapy. Obviously very, very buzzy right now. I'm sure it's just like another day for you, right? Like this isn't anything new. But that being said, I know I'm chatting with a lot of business owners too. Some have said it has been an absolute game changer for them. Like brain fog is diminishing, just more energy. I mean, is this a secret pill for what? Tell us a little bit about HRT. Like who is a great candidate? Who is not? I mean, is it great for everyone? It's getting so much press lately. And I'd love if you could kind of unpack this a little bit. Is it worth the hype?
So, it's definitely having its moment right now. That's for sure. And I do think it's worth the hype, because for a lot of women, it is the perimenopausal hormonal shifts that really start to take over. And you feel those symptoms, the brain fog, not sleeping is a huge one, or waking up constantly with anxiety that you never had anxiety. And now all of a sudden you do. So there is definitely a place for it. And I think it's about education, because you need to know there's so many different ways to do hormone replacement therapy. You've got pills, patches, creams, gels, pellets, many different routes, and some are more evidence-based, some are less evidence-based. You have to understand it to see what works best for you. And there's, again, hormone therapy, there's not a one size fits all. Everyone's regimen looks different because everyone's body responds differently to things. So there are many different ways. Majority of people are candidates. You've got your special medical issues that would make you not be a candidate, different types of breast cancer, different types of blood disorders. Those are kind of the two big ones that, it doesn't make them not a candidate, but we have to kind of approach it in a special way, in a different way. But for majority of people, it is a form of therapy that definitely helps that transition or going into menopause, because it helps you feel more balanced, more like yourself. But I think the key is it can be incredibly helpful. is used as a tool, but we have to find out which route serves you best. And that comes down to how you feel in your symptoms.
It's a huge part of our practice, I think. Dr. M and Dr. G, who's not with us today, but they're big believers. And I think evaluating a patient individually and understanding their symptoms and addressing their hormonal imbalance appropriately is important. And I think they've gotten very comfortable with doing that path. And I think my recommendation to people who are seeking possible hormone therapy, replacement therapy, is finding the right provider. You want to find the right provider who understands, takes the time to understand your symptoms, and is comfortable with managing the blood work that comes along with it. It's a range that they like to work within. So it's not a set in science, as set in the book science as much as some of the other things in medicine is. So finding the right provider is also important.
Hi, friends. I want to tell you about our new and improved authority accelerator from Factor PR called RealFluence. RealFluence is the only membership that helps beauty and wellness founders grow their reputation and authority to attract new customers without endless discounting, advertising, or going viral. Inside, you'll learn how to get recognized for your product or your expertise, partner with other founders, and become the name people trust and talk about, all with the guidance and community to support you every step of the way. Remember, you can't buy authority. You have to earn it. And RealFluence is here to help. Visit therealfluence.com to get started. In addition to HRT, I know at your practice that you also provide things like IV therapy. Can these things not just make you feel better, but look better too? Is that true?
Absolutely. Yeah. I mean, again, going back to Inside Out, they've been telling us for ages, decades, drink more water. IV therapy gives you intense hydration, makes your skin more plump and glowy. So it has the internal benefits of if you're lacking some vitamins or nutrients, you receive that, but you're also getting intense hydration, so making your skin feel better, making a lot of people also report mental clarity because their skin the body's getting flushed of toxins and such. So I think that's why a lot of these things go hand in hand. And I love our practice on that front, where, people pop in for their IV therapies and hormone therapy on the same day.
I think a big part of hormone replacement therapy that is often maybe not discussed is how nutrition also has to change in that time frame. Some ways we use habits we used to have 10 years ago, 5 years ago, doesn't work the same way. And why is that? And understanding the metabolism shifts that happen in perimenopause and menopause. I really focus a lot on nutrition as well, because it's all together. It's all comprehensive. We can't just focus on hormone replacement therapy. That's definitely one aspect, one tool that will help. But what about all the other things that's going on? It's so important. And it's not just hormone replacement therapy. It is that in addition to tell me what your nutrition is like. How much are we moving our body? It's so important that it all happens together.
Dr. M, I've never talked to my OB about nutrition. So now I'm very curious. You're not an average or an ordinary OBGYN, clearly. What are the shifts that women need to make in their nutrition at this point? I mean, you mentioned the way that maybe some of us ate 5-10 years ago. I mean, I get it. Not that I ever really binged pizza on Friday nights, but heaven forbid I would not, I know I'm going to pay for that dearly now. I mean, other than that, what are these shifts that you're advising some of your patients to make that you're seeing are making the biggest impact for them?
I think one of the biggest things is our protein intake is not so great in the United States. So understanding how much protein your body needs to not just fuel you, but keep you full. And how to do that realistically into your lifestyle, because it's a lot of meal prepping. It's thinking ahead. It's preparing ahead. And everyone is so busy to do that. So what do we do to realistically make those changes? And a lot of time I'm like, if you want to make a change, the whole house has to change, not just you. It's eating habits for your family, for your partner, everybody needs to be on the same regimen for it to be successful. So understanding the balance between your fiber intake, your protein intake, what are the good fats, what are the good carbs? Because carbs aren't evil. It's just about eating the right carbs. And then how to incorporate an exercise regimen that includes strength training and as well as cardio for your brain health and your heart health. Like, what does that mean? It's not intense cardio for 1 hour every day. Those days are over. It's about incorporating strength training and what do we actually do for that? And so that conversation is always part of hormone replacement therapy because it's not just the hormones, it's this aspect too.
Seems like too that weight loss would be nevertheless still a bit of a challenge. I'm sure you've also seen just like such an uptick in GLP-1s. Every other person is taking them or has taken them too. What are your thoughts on those? Can they be a useful tool for women and men? Are there particular stages in life that you find them to be most beneficial? Is it okay to take short, long term? Just give us a general overview on your experiences with it, if you wouldn't mind.
I definitely think if it's used as a tool, it can be beneficial. So when I say that, it's someone comes in, they are frustrated with weight gain. They are constantly trying to lose weight by making dietary changes, exercise, and they don't see the scale move. And sometimes it's your hormones that are also impacting that. But it's like the medication can be used as a tool as to kind of help establish some new habits without feeling frustrated consistently that you're not losing the weight. You are trying so hard, you're constantly hungry, and you're not seeing the scale move. So I think if it's used with a good diet and exercise plan, so when you eventually transition off or if you go into maintenance, you have those habits into place. And it's all about consistency. So a lot of times what I see is people do really well for 3-4 days, and then the weekend hits, and that consistency is gone, right? Or they do really well for 2 weeks. They get on the scale, nothing has changed. They're frustrated. They're like, well, why am I even doing this? I see that all the time. And I think personally, if we use it as a tool with having the right diet changes and right exercise regimen, it can be very helpful. But it's the balance, right? Too much of anything is not good. And too much of these medications, unless you're a diabetic, you don't need to go on these ridiculously high doses. What we're trying to do is use it as, hey, let's talk about your diet. So this week, we're going to make these changes, slow and steady changes, but you see the scale moving. So it's motivating you. With it.
Yeah. And I think that's a key part of it. I think that last sentence is the key part of it. I think using it as a tool to keep you motivated and on track. Because it is hard when your metabolism shifts at a certain age, for men and women, to lose the weight, to then feel good about how you look, to then present well to the world. It's all tied together, right? So if you're managing the hormones, and while we are managing the hormones, you are on GLP-1s also as a tool to get you to the next step of where you want to go, what your goals are to achieve those. And it makes it easier, right? So and then in that transition, people get motivated, they're happier. There's a lot of components that tie into it. And again, with our practice with hormone replacement therapy, we do as well a lot of GLPs because of that.
Are you also finding that men are experiencing shifts in their health and so forth, as they get older too, or is it primarily women?
No, men experience it too. It's just men talk about it less and women talk about it more.
Yeah.
But their bodies definitely change. Their eating habits, how they used to eat similar to us 5, 10, 15 years ago. It's catching up to them. You start seeing more mid-abdominal, lower abdominal weight gain in men as well. And lower motivation, lower energy, all of that related to maybe your testosterone levels changing, but also weight gain because your habits need to change too. And that's why I always say the whole house needs to change. It's not just you, but your partner, because of that very reason. It's happening, to everybody.
Yeah, that makes sense. I'm sure my husband will tune into this and I'll nudge him like, you got to stop bringing the tortilla chips into the house, please. Okay, I'm going to go off script here for just a second because Dr. Bahar, I know you recently got married. Congratulations. If you guys are not watching this on YouTube, please do because these ladies are glowing. So they're living the truth. They're living proof right now. Could you share with us your protocol, please? So we're going into the summer season. Everybody wants to look good, whether you're going to a wedding, you are getting married, whatever the reason is. Let's say you've got a couple months to get ready for something.
Yeah.
What would you prescribe someone to do?
I'll give you what I'm doing for myself. So I am getting married May 30th, and I started my protocol around end of January, beginning February. And I'm kind of going on a every 2 to 6 weeks of doing something. So what does that entail? One is IV therapies to keep my immunity up, my hydration up, my nutrients up. Facials on a very consistent basis to keep the pores clean, the skin clean, so my products at home can penetrate better. Lots of microneedling. That is just a superficial forcing of the cell turnover on my skin, sheds that skin, again, allows for better product penetration. Not a lot of downtime. I'm not, I come to work every day. I don't mind being a little red or beat up, but I don't take a lot of downtime. So it's a 2 to 3 day downtime. And then I'm about 2 weeks ago, started my injectables. So I do derma PRP, which is we take my blood, we spin it, we take my PRP out of it, and we inject it kind of all over my face, depending on what the areas I want to focus on. I did turn 45 this year, so things are starting to drop and fat pads are trying to separate. So I don't love my under eyes, so we put some PRP there. I picked up my jawline a little bit to alleviate the nasolabial folds. Put some in my jaw so it looks a little bit more snatched for pictures in May. And it's just all very natural because it's PRP, so it doesn't look like you put a filler in. Although I'm not a person who is afraid of fillers, we might add some tweaks of that in the next week or so, since I'm a month out now. But it rejuvenates the skin because of the PRP. It's your own PRP, the growth factors and collagen, elastin, all the good stuff come to the area where it's injected. So not only do you get plumpness, but you also get, your skin feels more and looks more refreshed. And I'm afraid of neuromodulators. So, I do that on my forehead, my glabella, crow's feet. And my favorite is my, DAOs, which is a muscle down here by your mouth that pulls the corners of your mouth down as you age. So releasing that with the tiniest dose makes the corners of your mouth go upwards. And you can't imagine how that makes you look younger without anyone knowing what you did. So those are my tricks. So you have them all.
Oh, we're going to have to write these down. These are good ones. Thank you for being so open and transparent. And what I also just want to point out too, you don't look like you had any of that done. Like,
that's the point.
Yeah.
Thank you. That's the point. I don't want, even, my husband, because we did officially get married. We're having the reception. Even my husband was, a bit confused. He was like, your skin looks great. And this is after I put 12 cc's of PRP injection all over my face. He didn't think I looked any different other than your skin looks great. And that's the goal. You want to place them so, elegantly in certain areas where we're working with your anatomy. We're not looking to change anything. We're not looking to be overdone. I don't want anyone to say, what did you do with your, I just want everyone to say, oh, you don't look 45.
Yeah. Which you don't.
Great.
Oh, yeah. Oh, that is so interesting. I'm hearing a lot more about PRPs and also like biostimulators like Sculptras. Those are different though, right? Okay, what is the difference and why do you elect one over the other?
I just chose PRP, but Sculptra is also a fantastic product. PRP is your own. So it's basically a biostimulant that's your own biostimulant versus Sculptra is a man-made biostimulant. but same effects. You don't walk out of here looking filled in. You get a lot of injections, but it's essentially triggering the body's healing mechanisms. So you put them, again, very strategically in certain areas of the face and body. Body does super well with Sculptra as well. And it triggers your body's collagen, elastin responses to those areas. So it does plump over time. So again, we usually tell people who are receiving Sculptra, it takes 3 to 6 months to see the full results, because it's your body kicking in the healing mechanisms, and that's not overnight. And again, because it's a biostimulant, it helps skin texture and tone as well. It's not just a straight volumizer.
That is so cool. Thank you for sharing more on that with us. And by us, I mean me, because I was asking for a friend, obviously. Asking for all of
an
us.
area I'm passionate about and can certainly talk hours about. So
amazing. All right, Dr. M, Dr. B, you have shared so much goodness with us today. If you wouldn't mind just sharing one more piece of advice, how can women who are listening to this, or somebody shared it with them, that are maybe feeling excited about what you shared with them, they're maybe in a different market than where you're based in Cleveland, Ohio, where do they start? How can they really advocate for themselves and seek the right kind of support during this season of their life? Because the way that I really, really look at this, and I encourage others to look at this, is like, if you are ambitious, like so many of us are, like, you need quality care in your toolbox, right? Like, that is, to me, I cannot, again, show up as my best self and show up for my clients if I feel like garbage, or if I don't look the part, so to speak. And I know we hear this at ourselves all the time, but still it can be hard to really live that truth because you don't know where to go. I think it's such a blessing that your patients have you. But for those that maybe have, they were the same OB that they've had since they were 16 and they don't feel heard, what can they do at this point?
I think, advocacy really starts with education. So if you need to search your area, and it is difficult. That is a challenge I hear all the time. And a lot of it has come down to getting on the internet and reading Google reviews and reading about different practices that are options in your area. And it's definitely challenging to find that. So I tell people, you have to ask around, ask your friends, ask your sibling, ask your whoever is seeking care elsewhere. If you like the way someone aesthetically is looking, ask them where they go, because that's a way to narrow it down. Because you're right, it is challenging to find that right connect. And a lot of it is you have to put that homework time in to search and find the right fit of a person.
For sure. I think tapping into your community is the biggest. Being open about talking about your issues and concerns and not hiding it, because probably the person, your neighbor, is going through it as well. And maybe they've done some research that you don't know about. And unless you ask, you won't know. And again, we see this amongst our patients. We'll have friends sitting in the waiting room together without knowing that they're both coming to see us, but they've talked about it, obviously. And they've been open with one another. So tapping into your community of women, and then doing a lot of research online. There are excellent providers out there. You just have to find them. And I always tell people, it's like dating. It's hard. But you will find your husband or wife or spouse or significant other. You just have to put the work in and not settle. If you go to find a provider and you feel like, no, this doesn't feel right. It doesn't,
It's not a right fit.
Yeah, it's not a right fit. They don't really get me, or etc. It's okay. You can move on. And just keep your exploration and options open. There are excellent providers out there.
That's so powerful. Thank you so much. And I think also, if you wouldn't mind sharing with us your website, your socials, you also provide such excellent educational content too. I want people to know what good looks like. So if you wouldn't mind telling us, where can people find and connect with you? That'd be amazing.
Absolutely. So our website is clevelandgyn.com. And we're on Instagram under 2 accounts. So you can see more of our aesthetics on the Well Westlake and the Cleveland GYN.
Amazing. Thank you so much for joining us today. I really love this conversation. I know it's going to help so many.
Thank you for having us,
Thanks for
Serena.
having us.
Thank you so much for listening. I hope this episode deposited some useful advice and insights to help you grow your wealth. If you enjoyed today's episode, be sure to subscribe so you don't miss any future conversations. You can find more resources, episode details, and updates at growyourwealthpodcast.com. And let's keep the conversation going on Instagram. Follow me at Grow Your Wealth Podcast. I'd love to hear your thoughts, questions, or takeaway from today's show. Until next time, remember, burnout is optional. Take care, and I'll see you next week.